infraspinatus and a supraspinatus. We're going to take this arm behind the back, and I want you to reach this arm up as high as it will go. Ideally, the tips of the fingers should be at the spine of the scapula. She's just about perfect, but that's okay. Now, in order to test the supraspinatus, this will test the infra and the supra. It's the most important test for testing both the infraspinatus and the anterior deltoid. The next one is going to test the infraspinatus, the supraspinatus, and the subscapularis. Would be, go ahead and turn around and face the public. Would be a mouth wraparound test. And in order to do a mouth wraparound test, we're going to turn the head to the side, hold it at 45 degrees, and then bring her arm around. Okay? And she's just about perfect. The fingers should be to the mid portion of the mouth. If there's hypermobility, they would come all the way across, except she's cheating by tipping her head. And again, just at the corner of the mouth would be for somebody with short upper arms. Now, in order to treat these, let's lay down on your side and face me. Now, for the treatment, generally speaking, the way it's going to be looking, I'm going to drop the arm forward, give her a pillow between the knees, and a pillow for the arms, so that she stays in a comfortable position. And I don't ever treat across the body like I'm about to show right now here. It's going to actually look like I'm coming from behind and coming across. So, but for viewing purposes, here's the spine of the scapula. Here comes the vertebral border. Here's the lateral border. In a fan-shaped position coming across is the infraspinatus. We put our fingers and sink into the center of that area, slide back and forth looking for the taut bands. Here's the taut band. I can now slide up and down looking for the nodular area of that taut band. And that's my pressure. That's where I'm going to hold it. So I can do it that way to get the infraspinatus. And again, there are multiple areas in here that can be having trigger points. To get to the supraspinatus, what I'd like to do is locate the spine of the scapula, slide to displace the overlying middle fibers of the trapezius, and then I can come to the head of the table and come straight down and be able to get these particular fibers. Again, I can use my body weight to do this. I don't have to lean into it or push really hard. I can still put some pressure right in through here to do the treatment. Now, a really good range of motion test for this that we already did is also the stretch. So reaching back the hand to shoulder blade will be really good to stretch out both of these particular muscles.